Welcome back. AI is the future, so everyone says, but could it now be coming for your doctor? A new study in JAMA found ChatGPT outperformed physicians when assessing medical case histories, even when those doctors were using a chat bot. The study showed doctors diagnosed patients with 74% accuracy, while ChatGPT got an average of 90% correct. So, how is artificial intelligence disrupting the medical field, and what does it mean for you? Here to discuss is board-certified orthopedic sports medicine surgeon, Dr. Robert Parisian. He's also an award-winning physician for his research for the use of AI in medicine. Dr. Parisian, welcome to the show. So great to have you. So, is the future of medicine AI?
Well, Lindsay, it's great to be on your show. Thanks for having me. Well, I think the future of medicine does include AI, and I think that's a great way to think of it. Can AI replace a physician? I would say, of course, the answer is no. But I think it can act as sort of an adjunct to things that we're already doing. I mean, looking at this study, for example, and I commend the authors and the researchers for evaluating this because this is a very, it's difficult to run these studies. They had about 50 physicians, and they had about 100 different cases that they went through, and they really tried to see if they can use AI to improve their diagnoses and their differential diagnoses. And in this study, they had three different groups. They had a physician group, they had a physician and AI group, and then they had another separate AI group. But I think it's interesting because if you really look into the study further, the physicians weren't trained really appropriately in how to utilize that AI technology, which again can be very useful and very helpful.
Do these findings scare doctors, knowing that these chatbots essentially outperform them?
So again, I want to look at the details of that study because rather than scaring, I think that as a medical community, we really need to embrace this. I think that AI is something that can be very valuable. Again, as an adjunct, is something that we can utilize to assist. And so, meaning when you look deeper in that study, many of the physicians weren't actually appropriately trained in how to utilize the ChatGPT. So basically, they were asking it questions like a search engine rather than just putting in the entire case report, which is symptoms, signs, clinical examination findings, lab reports. They could put this entire thing in, have ChatGPT then create and kick out a diagnosis, a differential diagnosis, and a presumed diagnosis that could have been very helpful. So once again, the clinicians weren't trained appropriately in how to utilize that in their favor.
So you've actually done multiple studies, one that found AI helped improve the recognition of fractures. But then on the other hand, Dr. Parisian, you actually had a study that showed that AI had very limited capabilities when it came to clinical outcomes following hip surgery. So essentially, you found that it can be helpful in some cases, but not in others. Talk about the pros and cons of AI.
So again, it goes back to training and continued training, right? How do you train the AI system? Do you continue to provide feedback to that AI system because it's learning as it goes, and you need that clinician in our case to continue to provide that feedback. In the radiology study that we did, we were appropriately trained in AI, so that we had AI assistance versus ourselves alone when we evaluated radiographs looking at fractures. And when we had the AI assistance, because we knew how to utilize it, we were able to have a 10% increase in our sensitivity when doing that. But we were more specific, we were more accurate as clinicians, meaning AI called out fractures that weren't actually fractures, and the clinician had to go back and realize that. Now, what we knew, what they didn't utilize in the other study was anchoring, meaning we didn't stick to our first perceived diagnosis and sort of ignore the AI and what it was telling us. We were trained appropriately to realize that they're going to come out with a differential, and on that differential, we need to look at that and evaluate that and to take all of this into account.
So is AI to a place now where doctors can trust it, or is more research needed to make sure that it can be an effective tool?
Well, I think our study evaluating and looking at AI as a predictive model for both patient-reported outcomes as well as revision surgeries, when we looked at hip arthroscopy, for example, it was a systematic review of multiple studies out there that have utilized AI. We found there was wide variability out there. There was no consistent model that was able to appropriately predict outcomes and revision surgery. So, in addition to that, none of the models had good external validity or generalizability across the board. So, no, I think we're a long way away, but I do think it's an exciting thing. And as a medical community and the healthcare community, I think it's something that we need to embrace. We just need to be active participants in this to make sure that we're doing it the right way and the most appropriate way for the maximize the outcome and the safety of our patients.
What is the adoption of doctors who are utilizing it? Do you feel like most people are excited about it like you, or are they more afraid of it?
Well, in medicine, I think anything in life, we talk constantly about the early adopters. Those are the ones that are going to adopt something as it's rising, and then the late adopters. And I think medicine's no different right now. You have many early adopters. You have some that haven't quite adopted it. They're going to be, in the middle, and then you're going to clearly have some late adopters. And so but I think it's helpful to, and I don't necessarily like using that adopter term and stuff, but I mean, be one of the leaders in developing this technology and seeing sort of where it fits in and what we do, and that's why we've done multiple studies on it to really try to fully understand this and understand the way forward so that we're training the models appropriately.
Only have 30 seconds left, but I do got to ask you this because so many people are afraid of AI in medicine. But you've actually found in your practice that it can be a useful tool to not only doctors, but also to patients. Talk about that quickly before we go.
So when I have patients come in, they're reviewing an MRI or some sort of imaging study. There's always a radiology report. So the radiologist reads it before I do. I read every single report, but then I look and see what the radiologist said. Patients now are actually using ChatGPT, punching in and putting in the radiology report. And I'll say to them, have you read your report? And they say, yeah, and I put it in ChatGPT. So I'll ask them, all right, what do you think? How is your understanding of what of your MRI findings, for example? And it's actually quite accurate. It's something that I actually want to look at more closely on how patients are utilizing it themselves to get a better understanding of medical terminology that they didn't quite understand before. But of course, they need to be put in context, and then the next steps need to be determined in the office with a physician.
Okay, a nice tool for patients as well. So much more to discuss, but out of time. Dr. Robert Parisian, great to see you. Thank you. All right, we'll be right back. Don't go away.